Hello, everyone. My name is Jack Lavin, President and CEO of the Chicagoland Chamber of Commerce. I'm delighted to welcome you to today's program, Navigating Federal Vaccine Mandates. Before we kick off, I'd like to acknowledge and thank the entire Chamber team for working tirelessly to deliver timely and relevant content to help you navigate through this pandemic. I especially want to thank Amelia Salter, the Chamber's Senior Director of Programs. She's doing an outstanding job and put together today's webinar with our Healthcare Council. As the world continues to deal with the impact of COVID-19, we know that trust and safety are top of mind for companies and their employees. The Chamber has publicly come out in support of mandated vaccinations because we know it is a huge component of ensuring we can fully reopen our economy safely. Now, as new federal vaccine mandates will soon impact employers with over 100 employees by requiring them to enforce vaccinations or test weekly, many of our members are looking for information and guidance to do so as efficiently as possible without exorbitant penalties and a clear picture of who pays the costs. This should not be a gotcha moment, new market for litigation, or an overly burdensome regulatory requirement, but rather a well thought out process where we all pull together and work towards the same goal, a safe return for our employees to the workplace and reopening our economy. COVID will be part of our lives for a long time. I had a government affairs person say we're gonna go from a pandemic to an endemic. I know I have a lot of healthcare people on the line and my definitions may not quite be right, although my dad was a doctor, so I have some knowledge. But the point is it's gonna be with us for a long time, and we need to find ways to operate efficiently, fairly, and safely. So we're thrilled to have a panel of employers and experts here today to share how they have successfully vaccinated an overwhelming majority of their workforce over the past year and regarding upcoming federal regulations. A special thank you to today's speakers for being with us today. Cara Friedman, shareholder, Polsinelli. Kirk Leemacher, Vice President, HR Service, United Airlines. Dr. Reinhold Urena, President, Amida Medical Health Group. And Mara Mcveigh, Director of COVID Safety, Prepared Foods at Tyson Foods. Thank you all for being here. We appreciate your time and being here. Today's program is presented by the Chamber's Healthcare Council, chaired by Dr. Julian Shink, Chief Medical Officer for Cancer Treatment Centers of America. We're now rounding out our third year with Dr. Shink as our chair, and for that, I want to personally thank him for his leadership and contributing his time, talent, and expertise so we can continue doing more programming just like this. Thank you, Dr. Shink. And with that, I turn it over to you.
Thank you, Jack. It's been a pleasure serving as chair of the Chamber's Healthcare Council, which is comprised of a diverse group of about 30 business and healthcare leaders, serving as our brain trust for all things healthcare related. This work is more important than ever as we continue working our way out of this pandemic. And I have to admit, 2 years ago, I never ever dreamt that we would be spending this time for such a long time talking about pandemics. I'm an oncologist, and I really thought that that would be a significant focus of our efforts. But clearly I was wrong, and this is the most critical healthcare issue we have. I would personally like to acknowledge and thank each of our council members, many of which are on the line today, for the time and expertise that they put into helping us develop this and our future programming. We really couldn't and shouldn't do this without your input, so thank you. The Healthcare Council meets quarterly and allows members to join on a rolling basis, so if any of you who are on this call today are interested in learning more, please reach out. We'd love to have you. We started this year off with a program back in January all about vaccines themselves and how employers were preparing to communicate vaccine safety and efficacy to their workforce. It's been a long 12 months. We've learned a lot. We knew that there were going to be lots of questions then, and even some uncertainty about what they should be doing to ensure a safe return to work. So now a year later, it's only fitting that we are beginning to close the loop and look at future directions, the effects of these vaccine mandates. And I know the title says the federal vaccine mandates, but realistically, we've got some leading edge companies on our panel today that were first movers in the mandating vaccines. And I am honored to have them speaking to us today. The lessons that they have learned and what they have taught us on this journey, I'm thankful for. And I have to say, if you look at Chicagoland, the last time I looked at the numbers, 77% of Chicago residents over the age of 12 were vaccinated. That's a lot better than the national average. So, the people who put these mandates in place early on have made a positive contribution to our committee or to our community. So, as Jack mentioned, we have a cutting edge panel of leaders who have been at the forefront of all this, as I just said, successfully vaccinating an overwhelming majority of their workforce. So I can't wait to hear what they have to say. And without further ado, then I will turn this over to our moderator, Amelia. Thank you.
Thank you, Dr. Schenk. My name is Mealy Salter. I am the Senior Director of Programming here at the Chamber. I have the distinct honor and privilege of working with Dr. Schenk and our entire Healthcare Council to spin out programming like today's. I'm really just here to ask questions. So without further ado, I would love to invite my panel up to the virtual stage, if you will. A quick reminder that we will have time for questions at the end of today's panel. You can submit those questions either to me via the chat, or you can chat me and let me know that you would like to unmute yourself and ask the questions yourselves. And if you'd like to do that, we would love to see your faces. So with that, I'm gonna ask to kind of kick off today's program, each of our speakers to just tell us a little bit about themselves, their background, their role in their organization. Kara, I'm gonna go ahead and start off with you. Oh, you're muted.
Thank you. Good morning. I'm Kara Friedman. I'm a partner in the law firm of Polson LA. I'm actually in the healthcare group, and I think I got pulled into some of the public health and safety issues associated with infectious disease several years ago when Ebola was kind of approaching our shores. Did a lot of work in that period of time helping healthcare facilities and preparedness for that. And ultimately, we've been very lucky not to have to deal with pandemic. And several years later, I've spent a lot more of my time advising our clients and sort of getting in the fringes of the labor and employment piece of this advising because of the overlap between public health and safety and quarantine and vaccines with labor and employment. So I'm really happy to be here.
Thank you. And Kirk, can I go to you?
Sure. Good morning, everyone. Kirk Liemacher, Vice President, HR Services at United Airlines. My responsibilities include our COVID-19 response, inclusive of our vaccine policy. When I'm not doing all things vaccine, I spend the rest of my time in our Employee Service Center, HR technology. I have responsibility for our global learning function, as well as pilot hiring and other administrative duties. Thanks for having me.
Wonderful. And Kara and Kirk were actually speakers on our kickoff event that we did earlier this year. I can't believe it's been 11 months, and it's great to have you both back joining us today to kind of do a status update, if you will. And Dr. Urena, can I go to you next?
Sure. Good morning, everyone. I'm Reinhold Urena. I am a family physician and the president for the AMITA Health Medical Group, which is our employed group at AMITA of about 1,100 clinicians. I also serve as the Chief Population Health Officer for the health system. And I've either been fortunate, or you can use other terms for what it is, to kind of be in the middle of the conversations around what a health system is going to do around the, the testing of not just patients, but testing of associates, the vaccine mandates, federal, state, and our own mandates. And so we've definitely had some experience and gone through a lot of tribulations that everybody's had to consider, no matter what kind of business you're in.
Yeah, and absolutely being a health system, you guys have really been at the forefront of this in the front line since day one. So I'm excited to hear kind of what you have to share. And then Mara, can I go to you next?
Yeah, good morning. My name is Mara Mcveigh. I'm a director of COVID safety for Tyson Foods. I mainly support our prepared foods division based out of the Chicago office, but I support all of our US enterprise COVID efforts. So our testing policies, our COVID policies in terms of quarantine isolation, and have supported all of our efforts around the vaccine mandate and hosting vaccine clinics at our facilities across the US.
Perfect. And I know you have a lot to share kind of about how you guys were able to get to such a high vaccination rate even before the mandate hit. So with that, I know on the prep call, and even I think since our prep call, which was Monday, Kara, there's already a ton of stuff swirling from the legality standpoint of this mandate. So I know we're going to cover more than just the federal mandates today, but I was hoping as our resident kind of legal expert on today's panel that I could kind of go to you to start off to just spend a few minutes discussing at a high level kind of where we are given the federal mandate as well as kind of the legality around it for our attendees on the line.
Sure. And sort of if I can start out with the public service announcement and consistent with the Chamber's decision to support employer-based mandates, I did want to, now that we're about a year into the vaccination process, point out that this vaccine has been found to be safe and effective, and especially in reducing morbidity and mortality. So despite the fact that there have been breakthrough cases, that we've seen that vaccinated people fare very, very well when they actually do become infected with COVID. So, and I am one of those survivors. Happy to say that my breakthrough case was very minor. Like all medicines, though, vaccines carry some side effects, usually minor and temporary. And more serious side effects are extremely rare, even with children beginning to be vaccinated. I just heard yesterday that there has not been a single case of myocarditis identified in a child receiving a vaccine so far. And a person's much more likely to be seriously harmed by the disease than the vaccine. One thing that I don't think I've heard people talk about is that there actually is a federal program to provide compensation for people who are injured by vaccines. And so that's sort of like when someone takes one for the team for the fact that they vaccinated, maybe not so much to protect themselves, but to protect them children or their elderly relatives or coworkers, that, there is a construct in place to compensate people if they were one of the unlikely people who are actually injured by a vaccine. I want to point out that there's a special program for people who are injured when the government is responding to a public health emergency. And it's not a new fund just related to the COVID-19 vaccine. And I think it's just important to point that out, because I don't want people to be under the impression that there have been many reported cases of significant adverse results. And then I did plan to talk, the focus of this was to be the federal mandate, but since there is a lot of questions about whether that's going to go forward, I just wanted to mention that there are both state and local authority under, the powers that are retained by state governments to mandate a vaccine at a level other than the federal level. And with most of the vaccines that we see, we generally expect that there will always be exemptions for medical people who are unable for medical basis to receive a vaccine to be exempt and to follow other safety protocols, as well as that to the extent that there is a religious objection from taking the vaccine, that those individuals may be exempt as well. Not only are state and local governments enabled under law to mandate a vaccine, but employers can do that as well, as long as they put those exemptions in place. I think that as employers, we are going to see a significant struggle trying to figure out what to do with individuals who indicate that they have a sincerely held religious belief that precludes them from receiving a vaccine. Most people know we've got a clear segregation between church and state in this country, And that means that our courts do not want to get involved in discerning whether or not somebody's belief that precludes them from getting a vaccine is in fact sincere. So that's sort of at the highlight of a lot of the discussions that I'm having with my labor and employment colleagues. How do we deal with individuals who, despite the fact that their organized religion that they've previously identified with, the leadership of those organizations indicates that they support the vaccine and having it disseminated amongst the population. Yet still this individual says, well, despite what my organized faith says, I still have a sincerely held belief that I should not be vaccinated. So, and as you implement a policy, especially now that you know that you're not currently implementing policy based on the federal mandate, you're really, I'm sure, aligning with legal counsel to get the best advice on how to implement those policies. And I think a lot of the employers who are part of this organization have already been grappling with that, knowing that they needed to consider mandating the vaccine despite what the law might require. Okay, so what's happening with the federal mandate? I will be brief, but both the federal government and the state government have powers to address the public health crises that arises when there is a pandemic. And the federal government's power associated with this comes from the Commerce Clause, which allows them to regulate interstate commerce. At the time that the Constitution was enacted at the end of the 18th century, there was no vaccine. So we are having to, make our impressions of what our founders would have wanted us to do if we had a pandemic that was where people could be inoculated against the disease by a vaccine. But we also, since the time the Constitution was enacted, have a heck of a lot more interstate commerce than we had at that time. So there will be continuing questions as to what the, plenary powers granted by the Commerce Clause allow the federal government. And I think the federal government will continue to try to figure out what its role is in preventing the spread of this disease. But at this point, we do take a general posture that the federal government should be getting involved in, the prevention of the spread of the disease. So in September, the Biden administration, through OSHA, Occupational Safety and Health Administration, announced that they were going to roll out a vaccine mandate for all employers who had at least 100 employees. And there are some guidelines in the federal mandate that says that there are options to allow employees to test and to wear face coverings instead of getting the vaccine. Additional details about the mandate were rolled out just over a month ago. And then soon after, there were many, many challenges filed to the authority of OSHA to enact this rule. It was in the Fifth Circuit in Louisiana that we had a decision. I can't even keep track of it, but it's just been days since that circuit, which was a conservative panel of 3 judges, 2 of them appointed by Trump, decided that the law was far overreaching from the purposes of the agency's authority. And I think I have my notes here. They had many different reasons why the federal mandate should not be imposed. The first of which was that what the 100 employee rule really was meaningless. It's like, if you're going to do a rule, then 100 people makes no sense. So then that says that you're overreaching your authority, or maybe you're underreaching it. They also indicated that it was not clear that COVID was a threat in the workplace that would warrant this agency's action. When they ruled, the Omicron variant had really not been reported a few days ago, and now it's being reported more and more. So at that moment in time, they said, we don't see it as being a public health threat. We all know that, this is an evolving situation. So whether that is a legitimate concern or not about a rule will continue to be analyzed, I think. Another thing that they said is this is really something that the states should have authority over, not the federal government. They said it's not a workforce issue. And they also said that OSHA hadn't been consistent about their position on the necessity of the mandate. So at this point, the federal government, and there are 4 different kind of elements of vaccine mandates that the government's tried to roll out in the last several weeks. But at this point, everything's been put on a pause. There are lots of lawsuits pending. Everything's been consolidated to a federal court in Cincinnati. And there's a briefing schedule underway right now, which I think concludes at the end of the week. So we're not sure what's going to happen, but stay tuned.
Wonderful, thank you. And that was a fantastic synopsis. So with that, I think here outlined is we really don't know what's going to happen with the federal mandate coming down. That being said, employers have the ability to mandate. And so I think that kind of leads well into our panel today, because we're going to talk to a few employers across various industries kind of about how they did that and the lessons learned and best practices shared. So Kara, thank you so much. I appreciate it. I just learned a lot there as well. I didn't know a lot of that. So thank you. With that, I kind of want to lead into our first question, which is we have 3 companies online have already, required vaccination among your employers several months ahead of what would have been a federal mandate. How did you communicate with your employees about the safety and efficacy of the vaccine? And are there any best practices you can share with the employers on this call as they might be preparing to do the same? So Kirk, I'm gonna go back to you and see kind of what you might have to share from United's perspective.
Yeah, thanks, Amelia. I would say 2 themes to our strategy of communication, and not just for the vaccine policy, but requirement that we ended up implementing, but even before that, was repetition and multi-channel. United has 70,000 domestic employees across hundreds of locations, and many of these people don't even go to work in those locations. They may pass through them. So the idea of capturing people through one means was just something we knew was not possible. So what I mean by multi-channel and repetitive would be things like utilizing our learning platforms to push required training that we took people out of the operation in order to take to educate on how vaccines work, how the COVID vaccine specifically works, and why it was safe. Utilizing our display screens, both electronic and bulletin board, going old school through pamphlets, same consistent messages, but using a myriad of channels and repetitively using those channels to get the news out. Guest speakers, they can't just hear it from United, they need to hear it from health experts and trusted health experts. CDC we brought in, Cleveland Clinic, Blue Cross Blue Shield, CVS, and many, many others. And not just making sure that panel was diverse and represented what our workforce looks like and is. The other critical part is this couldn't be an HR-led initiative. It was very important that it was, most of our employees don't sit in HR. We're a small organization at United HR. 90% of our employees are frontline, and those frontline leaders really needed to be the voice of the message. So what that means is walking the walk. Very early, 100% of our officers and 99% of our managing directors were vaccinated, and we continually repeated that. We also made sure that as those leaders were having any type of employee discussion, they had very crisp and consistent messages that they were sharing. But it just couldn't be those leaders. We also have 3,000 supervisors that support those 7,000 employees. And they were also armed with consistent and frequent leader talking points and FAQs. Because we got to the 85% participation fairly early after we implemented our policy. It was that last 10, 15% that required really the final piece of this. And I called it the hand-to-hand combat. It was the small group, the one-on-one, the leader, the break room conversations, the walking through the operation conversations. And it ultimately led to lists that we distributed to those leaders so they could go and seek out and have conversations with those individuals. It was a tremendous amount of work, but by getting to 99.7% of our employees, knowing the thousands and thousands of cases that we have tracked, the hundreds of hospitalizations and deaths, getting to that metric was well worth the effort. But it was intentional, it was repetitive, and it was multi-channel.
Well, congratulations on getting to 99.7% as well. And I know it's been a tough year or two for airlines as well. So you guys have really been working overtime, and it's great to hear that. Something you mentioned is kind of how you were able to bring in health experts. And so I think this is a great segue to Dr. Urena, who is leading a health system of health experts, really kind of at the forefront of this. Dr. Urena, is there anything you can kind of share about how you've communicated with your associates and gotten to build confidence in the vaccine?
So you would think that because we are in healthcare that we have all the experts that can just speak the language and get to our associates and employees in a way that really just makes them want to get vaccinated. But the reality is that that's obviously not the case. We're not very different in that respect because people come from all walks of life. But similar to what Kirk was saying, we had a similar approach. I think it really is a lot of different modalities you use to educate our employees. We have 19 hospitals that span the entire geography all the way down to Kankakee, and so we did rely somewhat on the ministries themselves, the hospitals, and the physician leaders there to have town halls with others and administrative people to educate down to even the one-on-ones. We have directors and managers that also would have one-on-ones with associates who they knew were conflicted on the vaccine status. We created a 90-minute educational webinar that kind of falls in line with what the state had wanted us to do in giving education to the employees. And so that I think served as a good reference point for a lot of our employees. But definitely having a fair amount of expert knowledge base inside of the health system, people who study this pretty heavily, you have a lot of opportunity to be able to educate our associates in many ways.
Absolutely. Imara, I want to kind of round this out with you because I know when we chatted, you kind of talked about a similar strategy, but really leveraging kind of some of the on-site focus and then also kind of the diversity in your communications. So can you share a little bit more about that?
Yeah, so I'd say at Tyson, we took a lot of the similar approaches that Kirk kind of talked about with United. We definitely had a lot of educational materials. Part of it was arming, supervisors, HR managers. We actually have occupational health staff on site. And so arming them with everything they need to kind of answer team members' questions. We started kind of a vaccine campaign back in January. And so our biggest things were, getting educational materials to our team members. And majority of our team members do not have email. And we speak over 40 different languages. So it was not only just how do we get this to them? How do we get it in their hands in the language that they speak so that they can digest it, themselves? So we really developed a ton of educational materials at a very simple level, getting it to our team members so that they could kind of just digest it themselves. The other thing that we worked on was getting access to vaccines. So making it as easy as possible to get vaccinated by hosting on-site clinics where our team members could stay clocked in, just basically stay on site, get vaccinated, as well as if they chose to go off site, we would compensate them for their time. So our two big things, right? Getting the educational materials in the language that they needed, and then getting access on site. So we pushed and it was 100% voluntary of just, having these clinics from January to July. And we got about 50% of our population vaccinated that way, just by providing those educational materials and making it easy. So we went into our vaccine mandate at under 50%. So we were not sure kind of where we would land with requiring it at that point. I think we had kind of the same approach following that. We continued with the education. We tailored it to basically those big concerns that we were hearing at that point. But through August, September, October, and our deadline was November 1st, we got up to 97% vaccinated by those efforts.
Wonderful. And I think we talked about this. Tyson was the first manufacturer to come out and mandate the vaccine for both kind of back office and frontline workers. So
yeah. So we made the announcement all in one. And basically our leadership team was first. They had a sooner deadline. Our corporate office had October 1st, but then every single frontline worker, US Tyson based, had a deadline of November 1st.
Wonderful. And as you guys are talking, something I kind of wanted to touch on, especially for our employers on the call, many of which, may be not quite as large and dispersed, but kind of over that 100-person limit, maybe preparing, is how were you guys able to be nimble, right? I think about all of the different information. I think we're up to O in the Greek alphabet now, where it comes to variants. Did not think I was going to be learning the Greek alphabet as much as I have this year. But how were you able to kind of create a feedback loop with your workforce, and how did that kind of feedback impact the different policies and procedures that you rolled out throughout the past 12 months? Kurt, can I kind of double back to you on this one?
Yeah, so it was, I think, as we've all been through, I would say all the panelists have a graduate degree and agility. If anything, we've been Gumby, for those who remember Gumby. When I think through the feedback loops for us, we have not only do we have a large workforce, but our leaders have an interest. We have congressional and regulatory considerations, and then 90% of our employees are unionized. So there's not a shortage of feedback. There's not an absence of being able to hear. But some of the things that we used, one, having a decentralized organization, we were very fearful of getting too much information out, especially in individual cases, and giving that to supervisors and others to deal with. So we did build a centralized function that really addressed those individual items. And that was either telephonic, or we've got a pretty robust case management system that is personalized and all that kind of stuff that we're able to leverage. But that consistent message was really important because of the agility. An answer that was framed one way this week could very be different in 3 weeks. And if we because of that consistently changing paradigm, we knew that we needed consistency in message, and thus centralization was critical. The other thing, and I'll give you evidence of it, that we realized is it was really important when we determined the mandate that we were all holding hands. And I'm saying all the way up through our board of directors, because superpowers don't bluff. I mean, this becomes cultural, something this significant. When you make this decision, it isn't, you don't back down for it, but you also have to be realistic. So one of the things that we ran into is, I talked about being decentralized. We had employees legitimately through all of this repetitive and multi-channel communication that got down to the last week before, and I'm talking hundreds, not insignificant numbers, and still did not know that this company policy existed. And these are good employees. These are long tenured employees, and they just didn't. And whether it's, as Mara talked about, where you have to speak English to work at United, but it doesn't mean that English is your primary language. And so while all our materials are always in English because of that job requirement, we adjusted our policy in the last few days because people couldn't find Johnson & Johnson to meet the requirement. So we adjusted and said, hey, if you at least get one in, we'll give you some additional time. So I more use that as evidence that there's an intentionality of when you establish that end goal, that you commit to it and fulfill it, but it doesn't mean you don't allow for a few detours in getting there to ensure this is about safety and it's about an ultimate goal. It's not, especially I know many of you probably on this call are dealing with a very restricted job market. And that's a factor in how we built our decision, but we also, it was not a termination exercise. We wanted to keep our United family as whole as possible.
Absolutely. And actually kind of touching on that ability to be agile, and obviously there's always a legal component. Kara, I kind of wanted to double back to you. You're working with a slew of different clients. What have you kind of seen employed, particularly maybe for some of your smaller and mid-sized clients, in terms of what's worked when it comes to them choosing to mandate the vaccine and communicate that out?
Yeah, leadership indicate, a lot of the same things that we've already heard, but leadership indicating, that they're out there doing it first and having a very high vaccination rate, or a lot of times I hear every single person on the leadership team is vaccinated. I think the area that we've spent a lot more time in as the legal resource for our clients is helping them figure out how to manage the religious exemption, the medical exemption. Well, first of all, I think it's important to understand that as a healthcare attorney, I work with clients who have mandated the flu vaccine for many years. So they have not received as many religious exemption requests as we're seeing now with the COVID vaccine, but they certainly have dealt with the medical and religious exemption. And so we've been doing a lot to help them iron out what their practices should be relative to those things.
Wonderful. And that kind of leads into another question that came up during the protocol, which is, we've talked a little bit about how you guys built a strategy to communicate and kind of specific to your different organizations, but are there any other steps or actions that you took to kind of encourage vaccination, and whether that was maybe like a more carrot or a stick type policy? So Dr. Arena, can I go to you with this one?
Yeah, that was actually pretty tough, and we analyzed a whole lot of scenarios. Do you incentivize associates to do this, and we just couldn't justify that. We quantified even at the point where how do we test our associates? And getting understanding that so much of the the state's mandate really ends up amounting to a testing mandate. And if we need all these our employees to be tested, can we do that ourselves and manage that? And everything we looked at was just full of concerns for us to roll that out ourselves. So it really does come down to, you heard the word leadership from our CEO, who communicates on a weekly basis to all of the employees of the health system. And a lot of it has related to this, because this has been the hottest topic that we've had, one of the hottest topics that we've had inside the health system. But I think one of the other factors in that communication has been just having a sense of empathy. Understanding that employees have done their own research, they have their own viewpoints, they hopefully understand the science of all this, but somehow just don't come to the same conclusion as we want them to. And having some level of empathy, the way that he communicates to them as well, just makes them feel like at least he understands where they're coming from. But at the same time, we're still going to keep firing the education. We're still going to keep pushing them. And hopefully in the end, there's some level of, desire to remain inside of this health system, because it's the job that they enjoy being part of it, because it's what they do in the mission to treat others, or it's just part of their inner being.
It strikes me, if I may, that some of the information and the work that our employer groups are doing to combat misinformation is important and necessary. But as with other public health issues, it seems very important to acknowledge the role of people like primary care physicians, religious leaders. There's a barbershop sort of component in some communities for public health education, that we really need to broaden out, how the misinformation is going to be reduced and discouraged beyond the employer, because there's kind of a lack of trust at times with the employer. So I would hope that we would see that piece of it expand from a public service announcement and networking component.
Right, and being in healthcare does not remove us from misinformation existing. So yeah, I agree.
Yeah, that's a great point. There is some data that shows, I don't know if any folks online are familiar with the Edelman Trust Barometer, but it's an annual survey they do where they kind of measure trust of the public in various institutions. 2020, pre-pandemic, was the first year that they found that confidence in one's employer was higher than government or public entities. And I believe that has continued. So kudos to all of you for kind of taking a leadership role and meeting your employees where they're at. Because I think that is, there's definitely a public health component, and there are groups working to build confidence in vaccines overall, kind of leveraging nonprofit and care, as you mentioned, religious leaders and public health officials. But I think employers have such a strong role in that as well. Mara, and I recall you talked about some ways that you were kind of on the carrot side of things, if you will. Can you share a little bit more about that?
Yeah, so prior to the mandate and continuing after the mandate was required as well, we compensated team members that if they got vaccinated off-site, we compensated them for their time. If they got vaccinated on-site, we allowed them to stay on the clock as well. After the mandate was made, we also did some sweepstakes in our facilities, and team members would be eligible as soon as they got their first dose. And so we saw this to be pretty beneficial in our facilities. It felt like it took some of the voice away from people that were against the mandate, and kind of a lot of people, kind of celebrated the fact that, I got my first dose. I'm excited for this sweepstake. I want to be a part of this. And so we saw a lot of that kind of be beneficial. One thing that we really saw is going back to the empathy side is those small groups, having small discussions with people. There were people that I had discussions with that when I walked away from the conversation, I said, there is no way this person may choose to get vaccinated just based on the misinformation they have, the beliefs that they held. And ultimately, I think just even feeling like that somebody took the time to sit down with them, answer their questions honestly, listen to their concerns, they really felt heard. And ultimately, some of those people decided to get vaccinated and stay with us because of that fact, right? They felt, they took the time to actually listen to me, and they may not be against getting vaccinated. They may just be against the thought of being told, right, to do something.
I have learned that people have a lot bigger fear of needles than I ever understood. I mean, some people that say they don't want to do it for religious or medical reasons may be doing it out of a fear of needles. And I don't know, maybe Dr. Schenk knows, or Dr. Urena, whether or not they're working towards a nasal vaccination or anything like that. And I wonder if this employer group thinks that that would help to increase uptake.
I don't know if I heard the needle fear. I did hear one thing, Kara, that I think you hit on. I heard a lot from team members that, well, what if I have an adverse reaction? And so we could talk through the science of, that it's very rare. There's the likelihood of you having a severe adverse reaction. Some people just had that fear of, I may be afraid of needles, but what if I provide for my family? What if I'm unable to continue to provide because I get this adverse reaction? So some of that of, right, that the protections that, since we're asking you to do this, and if you do have kind of an adverse reaction, you could be covered.
Can I ask a quick question, kind of touching on that too? Is I know we all talked about how I think everyone was allowed to either get vaccinated on the clock or get that time back if they got vaccinated off of the clock. Did you guys offer any provisions for people that might have gotten sick after a dose would they have additional PTO? Was there anything that if someone was worried, hey, I might get this and it knocks me out for, 3 or 4 days? Was there any conversations about that? Mark, can I go back to you with that one?
Yeah, we definitely thought about that, especially with big on-site events. We definitely planned that and kind of planned on the production side of it, that we thought, maybe we'll vaccinate on a Friday and not have production on Saturday. So everybody already has the time off. So we planned kind of thinking through that, kind of giving that time back so that it doesn't really disrupt the operation side. But otherwise, we absolutely had time off for individuals that if they had any side effects, they were allowed to take that time if they needed it.
Kirk, did United do anything similar?
Yeah, so unfortunately, we don't really have a day off. Our operation continues to run 24/7. There's no stopping that machine. So the approach we took was wherever possible, we brought vaccines into the operation. Now, because of the safety sensitive nature of some of the work, the FAA regulates how you can be vaccinated and how soon you can go back to work, and for some of our roles. And so we had to deal with that paradigm. And I would say what we did very similar to Mara is we allowed people to take off without any consequence. So we have dependability programs to make sure that we are, appropriately staffed to run a safe operation. And we removed that barrier. We also offered incentives that were meant to be, we tied it to really a replacement of pay for the time to get vaccinated if they weren't doing it in the operation. So it was less of a full-fledged, we're giving you a bonus for getting vaccinated, more to make you whole and really tie it back to the core principle we have, which is our guiding principle at United, which is safety. And so as long as we brought it back to the safety, it was less of a carrot, it was more of a compensation for your time component. I would say that, and just to be clear on incentives, I think it's a critical part of progression. I think, education, access, incentive, or compensation for time, call it, but that last 15%, that last 10 yards, it has to be the stick in some ways, and there has to be that consequence. And I've yet to see an employer being able to truly incent to get to that level of full participation.
That's a really great point. And it actually leads us into my next question. I do want to remind attendees that we do have time for questions at the end, so you can send those to me. I did see a couple coming in, and I am taking note and promise that I will get to those. But you kind of mentioned the need, to go up past even incentivizing, right? And we are in the middle of a national labor shortage right now. The Chamber has done multiple events about the Great Resignation, the turnover tsunami, the Great Reset. I don't know what it's branded right now. But I posted, have you guys as employers that have stepped forward, mandated this vaccine even ahead of any kind of required mandate from the government? Have you seen that all? Was that a factor when it comes to labor shortage? Kirk, I'm going to kick back to you just because
and I'll be quick because I want to definitely learn from the other panelists here. We had the same fear, definitely had that fear. We stepped into it progressively. So we started in June of this year, 2021, with a vaccine requirement. Even before we made it for active employees, we were basically putting our toe in the water of what would this do we knew it was directionally where we were going, again, tied back to safety, but we also knew we had a travel coming back, a need to rebuild the airline. We really did not see an impact directly on interest and applications, and still do not. But it definitely was something that kept me up at night, and I watched those hiring metrics daily during those few weeks until we announced it for our active employees.
That's a really interesting strategy that you did it kind of with the new hires. And I think that's something that could probably be a lesson learned as well for some of our employers on the line. Dr. Reina, I want to go to you next with this one. Obviously, the healthcare industry has been just hit hard by this whole thing. Have you seen any impacts in kind of your workforce, or was that a factor at all as you were kind of deciding how to address this and roll it out?
Well, obviously dealing with the actual management, the treatment, taking care of these patients for the past 2 years, it certainly has taken a dramatic hit onto our workforce, just purely from a burnout standpoint, especially for the frontline people working in the hospitals and the ERs and such. But even on the primary care side, we've seen docs themselves who are retiring a year or two earlier than they would have, just because they know this thing is going to go on for a time still. But as we put our mandate into effect as a hospital system, I think we knew that there was always a possibility that we were going to any health system could take a hit on that. And if anybody says that they didn't think about it, I'm not sure that's necessarily true. So, yeah, we have not seen as big of a hit from that standpoint. It is really still more so just, I think, the burnout factor more than anything else.
Yeah, and we actually did an event just through the Healthcare Council in September. It was all kind of burnout, and we had the head of mental health for the Chicago Department of Public Health really looking at how we make kind of burnout and loneliness a public health issue as a result of the pandemic. With that, I do want to, oh, go
Could
ahead.
I just mention one thing? When we talk about the workplace shortage, and I feel that it's really driving employers' decisions about how to handle a vaccine mandate, they're really afraid that they cannot lose any more workforce, especially in something like the healthcare industry. It makes me think a lot about immigration, and it is such a hot button issue in this country that we are dysfunctional when we think about it. But we used to recruit a lot of, and we still do recruit a lot of physicians from other countries, but we used to recruit a lot of nurses from other countries, and a lot of hospitals were known for having large Filipino workforces, for example. And so to me, it makes me think that we're going to have to take a lot closer look at our professional immigration policies to see if we can get some resources from other countries if we're not going to be able to get people to work in the office, which is for healthcare workers in the hospital and other facility settings. Dr. Urena, I think it was you that mentioned that people want to work remotely who have been in the on-site workforce in the past. And if that's what people can choose to do in this day and age, to the extent that they're professionals, they're employable here, then we need to go to a secondary workforce, which is probably other countries.
Yeah. And I think too, that's something the chamber's doing a lot of stuff around talent and workforce. And I know we have a couple groups that specialize in immigration. So maybe, Kara, we can double back with you on that too. It's an interesting take. I do want to make sure we have time to get to the attendee questions. So one that came in is, are the speakers willing to share any promotional materials that they used to educate their employees? So I know we talked about you guys have some kind of robust internal systems, but are there anything that you guys used, any specific resources, whether internal or external, that you would want to point folks on the call towards?
I know that
usually those are proprietary, but go ahead, Dr. Urena.
Yeah, I was going to say, there definitely is a fair amount that is proprietary, and I should say that we've gotten a fair amount of support from. We have two parent companies, but Ascension Health, whose name you'll probably see a lot more in the Chicagoland area coming in the next 6 to 8 months. They have given us a lot of resources here at the local level. The CDC, obviously the state, there are a number of resources that they've suggested. I'd have to see if I could find that email that kind of links to to what the state's resources are that they suggested giving to your employees as part of that 90-minute educational recommendations that they'd given.
Yeah.
And I'm with Dr. Urena. The CDC really upped its game from the early day of the pandemic. I mean, their site used to just be a mess. And now it is easy to read. It is easy to understand. We created a lot of our content early on because of that gap. Now we just almost link directly to the CDC assets. So I think to the point, I agree. A lot of the stuff that we've written at United is so specific to our industry and our workforce that I've done this with other employers, and they kind of look at it and go, oh, I can use these two answers, but nothing else. I'd really highly recommend mining the CDC, not only the data, but just the content. They've definitely gotten the right people on their site now.
Perfect. Well, nice plug for the CDC's communications people. And Dr. Schenk, I know you messaged a question, but you're on the line. Do you want to go ahead and ask?
Well, yeah. So I have a question of our Tyson and United colleagues as industries that obviously have huge healthcare expenses, and I'm sure you track those. I know you track those. Have you been able to measure the benefit of having a significant portion of your workforce vaccinated, and really, if you compare the time before vaccination with the time after, I would hope you'd see some other, just cost benefit. Have you been able to measure that, and can you share that?
I will say that it was not any way a factor in our decision-making process. But I will say that the average hospitalization for COVID for us is about $65,000. And so, that's a fact. But, if you think about a lot of the other healthcare expense we have just to run our operation, the testing component that still is ongoing, all this kind of gets lost in that noise. So I think it's too early to say what the financial implications are, but just that one data point. And I think that's not United specific. I'm sure Mara has a similar metric, and all the other employers here is probably dealing with that same component, but it really did not factor into any of our, decision process.
That does remind me that some employers are charging a higher premium for employees who refuse to get vaccinated. I think that's a very interesting strategy. And I think I saw Singapore will not provide medical care to people who are not vaccinated.
Interesting.
So I have another question as well, and that is, what percentage of your employees have received a religious exemption, and what sort of rigor do you apply? Do you have a committee that reviews those, or how do you verify those religious exemptions?
Dr. Urena,
Hey,
you want to
Sure,
Those
sure.
came up.
Yeah, I know from our standpoint, we had we were pretty intentional about both medical and religious exemptions. And so to your point and your question, we had separate committees, one for the medical and one for the religious exemption side of things, that reviewed every single one of the exemption requests. Really, there were no straight pass-throughs. It's like I say I believe this, and you get a religious exemption. There just wasn't that. But that's just the way we handle that part.
Absolutely. And Mara, do you want to jump in? Because I know.
Yeah, I was going to say, so we already have a very robust accommodation process, especially for religious requests. So we continued that. I would say for the most part, we didn't challenge them, right? If somebody said they had firm beliefs, we would ask for the specific documentation. We didn't take it further than that, really.
Perfect. Wonderful. Well, we are right on time. I want to take another moment just to thank all of our speakers. And I especially want to thank you guys because we have a health system, an airline, and a manufacturer. You keep us safe, you get us where we need to go, and you keep us fed. You were all essential workers, kind of keeping moving as I was trapped in my house for a year. So I just want to say a special thank you to you guys and for joining us today, and for our attendees joining us today. Quick reminder, this is recorded, so we will share it with you guys if there's anything you want to go back and look at. Dr. Schenk or Jack, do you have anything else to add before we
echo your thanks, and I'm most grateful for you all taking a lead on this. I mean, you set an example for employers all over Chicagoland that this is doable. I mean, you took the lead and you did it. Kirk, I loved a comment you made, which is something about superpowers don't bluff, and that I think that's just a fantastic point. People, and you are a superpower. You're all superpowers, and I appreciate you demonstrating.
Yeah, I just wanted.
Oh, sorry. I was going to thank Amelia for her leadership. She really put together a great presentation. Go ahead, Jack.
Absolutely. Amelia did a great job moderating and putting this together. Dr. Schenk and the Healthcare Council, thank you for your leadership and all this. And I want to just echo what Dr. Schenk said. I want to thank all our panelists, Cara Friedman with Polsinelli, Kirk Liemacher with United Airlines, Dr. Reinhold Urena with Amita Health Medical Group, Mara Mcveigh with Tyson Foods. You all are providing leadership on this issue, on vaccinations. It's all fluid. Issues are changing all the time, but you guys provided leadership, especially on the vaccination, which was a hard stand to take. back in August, which we recommended and put out a statement on that back in August. But it was a hard thing to state. We got some pushback, but it was the right thing to do. We are making great progress here in dealing with the pandemic and getting people back to work in our economy moving forward again. So thank you all again. Thank you all for joining us today. This is a fluid area, the pandemic, the regulatory environment. So please let us know if you have any questions. Visit our website, www.chicagolandchamber.org, for any changes, the recording of this, but also for latest updates. So thank you all again for joining us, and have a great holiday season. Bye.